My name's Lt Col Elizabeth Hunt. I'm a military psychiatrist and I'm based in Edinburgh. What inspired me to choose psychiatry was reading a book called Regeneration when I was about 17, which is all about the sort of therapeutic relationship between a military psychiatrist and his patients. It just blew my mind, just how the relationship itself and creating that trust and understanding, and then with sort of reflections back between the patient and the psychiatrist, could in itself be curative, and was hugely thrilling. And so that's what made me choose medicine. And then when I later discovered that military psychiatry still existed as a subspecialty, made me absolutely certain that that was what I wanted to do. I don't think there really is a typical day, but I'm based in Scotland. I cover all of Scotland, so sometimes I'm at Fuzz Lane at the submarine base, sometimes I'm in the north with the RAF, sometimes I'm with the infantry on the east coast. So it's geographically quite diverse. Every patient is so different that it means that no day feels the same, even if you are in clinic for a number of days together, because you're just hearing so many different stories and getting involved in such very different cases. I have quite a diversity of cases that I see. So we have depression, anxiety, alcohol difficulties, and I think what people tend to think of with military psychiatry is post-traumatic stress disorder. And though that isn't the majority of things we see, we do still see quite a number of those. There is a myth that if you suffer from PTSD, that's the end of your military career. The truth of it is that we have treatments that are extremely effective with helping people with PTSD, that we can offer those within the military, and people do return to have a fulfilling career. There is a possibility of being deployed, which is tremendously exciting, and it's nice to have that knowledge. You can have even more variety in your work life than you would get in a normal job. So psychiatric colleagues of mine have been deployed to Iraq and to Afghanistan as psychiatrists, and also one was fairly recently deployed to Sierra Leone as part of the Operation Gridlock as well, and I think that they've really enjoyed those experiences. I think you have to have tremendous curiosity. I think it is the most privileged position you can possibly have to find out someone's story, hear their story, and then help make that story better at the end of it. I don't think that there are many other professions that get to have that degree of curiosity, but that amount of satisfaction in knowing that you've made a real difference to someone's whole life and to their family around them.
Make a difference. Choose psychiatry.